Hospitals in England are to bring in a new system designed to flag up children who may be a victim of abuse or neglect. The £9 million scheme will automatically tell nurses and doctors if the child is already known to be at risk or has had urgent treatment at other hospitals. Katie Razzle has the details.
Baby P died with more than 50 injuries, abused by the people who should have loved and cared for him, let down by the health professionals who could have protected him. 7 years earlier, 8-year-old Victoria Climbié died after months of horrendous torture and abuse. Her death, too, was preventable.
Some parents who abuse children or neglect children, we know, can be very devious. So what this is about is making sure that all those different hospital, IT systems, urgent care settings and social services all talk together properly so that we can protect vulnerable children.
The database will start being created in England's NHS hospitals next year. It will link up existing at-risk registers run by social services, raising an automatic red flag when a doctor calls up the notes of a child who has any protection plan. It will also bring together the records of a child's visits to different A&Es, another potential sign of neglect or abuse.
The A&E department at this East London hospital sees around 25,000 children every year. At the moment, if health professionals here or across the country have concerns about any of those youngsters, they have to manually check with social services whether they are known to them. This hospital will be one of the first to trial the new system when it goes online in 2015.
Dr. Simon Eccles is the consultant at Homerton who's behind the new system.
To keep a child in hospital when the parents want to take them home is a very big decision.
Dr. Eccles is haunted by the death of a child he treated at another hospital a few years before Victoria Climbié died.
None of us could determine whether this child was subject to abuse or not, and it was a very tight judgment. We decided that the child should go back home with social care input, and the child subsequently died. And I felt awful that had I had more information, I might have dealt with the situation differently.
The lack of information sharing between agencies is one of the issues raised time and time again when a child dies of abuse. So will this new system protect our most vulnerable children?
Most children who are abused will never find themselves in accident and emergency. They will never find themselves at the place in a place of safety. So I think it would be ill-advised to be lulled into a false sense of security that this will be the answer to the problem of child abuse.
For most of the parents who do visit A&E, it can be an upsetting experience. Some take the trip often and fear they may be falsely accused of child abuse. But the parents we spoke to were supportive.
It's a great way of making sure that children are protected, and it's a small thing actually to do.
If people were going to different A&Es with similar injuries, it will send up an alert signal, which is actually fantastic.
The NSPCC points out that people, not databases, protect children. In A&E, that's the health professionals. It's their quality and skills which will make the difference.